Hello. I started to wonder.
I'm really sorry. Hold on.
You're still okay. So it's with great pleasure that we have Isabelle Budin Ljosne today, who's from the Norwegian Institute of Public Health, who's going to talk about the work that she has done as part of her PhD, but also as part of her general knowledge of working in this field, which is really starting to build up now. So Isabelle, I'm going to hand it over to you and to talk about patient and interest organizations' views on personalized medicine.
Thank you, Jane, and thank you for inviting me to talk about something which I am genuinely interested in and that I hope will be interesting to other people as well. So in this talk, I will be describing a study that we conducted, which was published in 2016. The data collection took place in 2014 and 2015. So this is not a brand new study, but hopefully the results are still valid. And I will try to toward the end of my presentation, discuss how we can bring the results from this study further and use it for next steps and further research. So what I will do is, if I just find how to click here, is that I will shortly describe the context and the background for the study, the methods that we used, then I will go through the main findings we had, and we'll discuss how we can move on. And this is something that we are trying to do in a new project now that I will mention for you. So in 2014, the Norwegian Cancer Genomics Consortium was established in Norway, and this was a very large project gathering all the main regional health authorities in the country, the Norwegian Cancer Registry and the Norwegian Institute of Public Health. And this project aimed at developing strategies for personalized cancer treatment using genome sequencing technologies. This was the first project in Norway doing this. And as you know, the whole idea of having such a project is to tailor treatment to the specific needs of the patient based on the patient's individual genetic profile. So in this project, we had a work package dedicated to LC work. And one of the objectives we had in this work package was to explore the views of a variety of stakeholders regarding personalized medicine. I will use the term PM. So we wanted to know more about how we can develop something like personalized medicine and what are the critical issues that we need to take into consideration. And as you know, there are many different stakeholders of personalized medicine. Patients are an obvious group because they would be like the end users of personalized medicine. Public and private research organizations are very important to develop the whole approach of personalized medicine. Health authorities, policymakers are a key stakeholder because they can make it happen. They can give us the means and the resources to make it happen. Pharmaceutical industry is an important key stakeholder, educational institutions, and among all these different stakeholders, we have patients, patient groups, patient and interest organizations. And this group of stakeholders is often mentioned by the promoters of PM as a very central group of stakeholders. You are probably aware that several reports have been written on personalized medicine, describing the steps that have to be taken to develop personalized medicine. These reports have been written by policymakers, by medical organizations. And basically, in many of these reports, they are mentioning that patient groups have a very important role to play. I'm not going to read through all of this, but it is, for instance, mentioned that the patient advocacy community represents a strong and valuable player in this arena. patient groups are seen to be key to provide easily understood information to patients about PM. They can help increase the literacy of patients, help them understand ways to empower themselves. So, and they can also contribute to research, to developing research toward PM. So patient organizations, interest organizations are seen as really key to developing personalized medicine. And this kind of created some interest in our group because I had been attending biobank conferences and research project conferences, international conferences discussing genetics, personalized medicine for many years, and I couldn't recall to have met representatives from patient organizations on a regular basis. This was rather the exception than the rule. So we kind of wondered, but where are the patient organizations? What do they think about PM? What is their role in this, or what is the role that they would like to play? So we did set up this study with the objective to investigate the views of leading representatives from PIOs, patient and interest organizations, regarding PM in general, how relevant it is for their activity or their disease of interest, the types of challenges and opportunities that they saw for the realization of PM, the types of recommendations that they could provide us to make PM accessible to as many patients as possible, and the type of tools and strategies that they may have, if they have any, to enhance the realization of PM. And we started to look around, try to find out who should we talk to, and we found out that there are many PIOs out there, and that they vary a lot in size, in denomination, and in mandate. Some call themselves patient advocacy organizations, some call themselves health charity organizations. So we had all these different groups, thousands of them, and we just needed to make a selection, which was not easy. So we decided that we would focus on PIOs represented a variety of disease areas, spanning from cancer, since we were part of the Norwegian Cancer Genomics Consortium, so this was interesting to us, but also PIOs working within genetic disorders and other types of diseases. So what we did is that we sent out an email invitation to a small group of PIO representatives that we had some connection with within the context of the Norwegian Cancer Genomics Consortium. And we used a snowball sampling method. So we basically asked them to recommend us, give us ideas regarding who we should talk to. And we also sent out invitations to representatives of 20 disease-specific PIOs that were members of the European Patients Forum, a large umbrella or a pan-European organization for patient organizations. Through this method, we could talk to a number of representatives, and we conducted semi-structured individual telephone interviews with them. And we talked to PIO representatives until we had reached a point of saturation, which means that nothing new really came out of the interviews. And these data were analyzed using a conventional content analysis approach. So through the European Patients Forum and the Norwegian Cancer Genomics Consortium, we came in contact with 13 different PIOs. And you can see the list of the diseases that were represented: cancer, genetic disorders, mental health, diabetes, psoriasis, AIDS, lupus, and primary immunodeficiencies. And these PIOs had very different characteristics. Some of them were quite small and maybe only at a national level, while others were very large, were umbrella organizations covering all of Europe. But we managed to get in our group PIOs representing Norway, UK, Belgium, Croatia, Denmark, and one in the States. So basically what we found out is that there was general interest about PM among the representatives we talked to. They experienced that current medical needs are not sufficiently met. Patients often have to go through different medications before they find the right one. So they definitely knew that there are issues of wrong treatment, overtreatment, undertreatment, side effects. So, so for them, this was really, PM was really of interest, even though the topic or the concept of PM was new to some of them. This was not a concept that they necessarily used. And it became clear that cancer PIOs were more aware of the concept of personalized medicine than those that were working within other areas of medical research. So we asked them about the types of challenges that they saw coming up the horizon. And one critical challenge to them was the cost of personalized medicine. Because they experienced that currently patients often struggle to get access to the types of treatment that they need because of cost issues. They experienced that the price of drugs were often very high, and this particularly applies to cancer treatment. They saw that healthcare systems are under great financial pressure. So for some of them, they were questioning the ability of these healthcare systems to fund personalized medicine. They also believe that personalized medicine as a highly technological approach would require more medicalized follow-up in the form of genetic testing, for instance, and that would increase costs. So basically their great concern was to make sure that PM can be made accessible to people in an equitable way. And they were also concerned that some patient groups may be forgotten because they may be not so interested for pharmaceutical industries if they represent a very small group of the population. Another observation they made is that the necessary infrastructures for realizing PM are largely missing. They experienced that the necessary infrastructures to enable data sharing are not sufficiently developed in their countries, and that privacy concerns could hinder data sharing. And this was quite interesting to hear about, that they experienced that current regulatory frameworks could maybe be too strict and make data sharing difficult. They also experienced that healthcare systems are very slow at adapting to changes. For instance, drug licensing mechanisms are very cumbersome. It takes a lot of time to get a drug approved. And they also experienced that politicians are not so interested, and this varied between countries, but maybe these politicians are not so interested in new innovative medical developments. The PIOs also experienced that patients may not be ready for personalized medicine. So there was an issue of health literacy and understanding genetics. They experienced that very often patients do not understand basic medical information, do not understand why they have to take a drug. They also experience that healthcare professionals often struggle to understand the basics of a disease, especially if it's a rare disease, and suspected that they may not be sufficiently trained in genetics to use them in clinical, to use this information in clinical settings. There was also a concern that prevention based on genetic predisposition may not work, and some parallels were drawn to public health traditional prevention, so to speak, which has not been very successful in certain areas. One PIO representative was mentioning fight against obesity, for instance. Another concern they had is that the general public may not be aware of the need to share data, so the support from the public may not be there. So based on these different concerns, we asked them to come up with some recommendations, as seen from their perspective. And basically, they insisted on the importance of conducting more research and involving patients in research, because we experienced that patients very often are not offered the opportunity to participate in clinical trials, for instance, even though they may want to do it. Developing mechanisms for equitable access to PM and sustainable drug pricing was seen as very important. Developing infrastructures for data sharing, making sure that good privacy protection mechanisms are in place, and asking for permission before sharing data was seen as very critical. Some representatives mentioned that it might be useful to implement PM gradually, starting with pilot projects with those patients most in need, and that would be patients for whom treatment does not exist at the moment. And developing criteria for priority setting was also seen as important. Another critical point they made is that genetic information has to be provided to patients in a simple way, respecting their right not to know, and making sure that if such information is provided, then it should be accompanied with some medical action. Protection against genetic discrimination was also seen as important, and a key message was also to take into consideration patient values and perspectives. Some representatives made a point of saying that patients are not just a bunch of molecules, they are also human beings, so these should be taken into consideration when providing PM. Another point that was raised by almost all of the representatives I talked to was that they wanted to engage in the PM agenda. They believed that they could contribute through a number of steps, by commenting on developments, by engaging with regulatory bodies, HTA bodies, for instance, by educating patients in PM, supporting research. Some of them are very active in doing so already. They could also be watchdogs if necessary, and help identify areas in which PM is most needed. And they could also contribute to enabling data sharing. So they were very aware of the fact that they could contribute more to PM than what they currently do. And they would like to contribute more, but some of them didn't know how to do it, or were a little bit hesitant, and maybe felt that receiving a helping hand might be useful. So learning from this study, well, the key message to me was that, okay, we need to work more closely as a research community with patient organizations. So the question is, how do you do this? How do you make it happen? Stakeholder engagement is increasingly encouraged in Europe for a variety of reasons. In Europe, we have the so-called Responsible Research Innovation Framework that encourages to set up forums and platforms where stakeholders can meet and talk together about new innovations, about new medical developments. So it is clear that this is something that is also expected from funders, but how do you do it? And there are a number of questions that arise. For instance, how do you select the patient organizations you want to collaborate with? Just by doing our little study, we realized that it would be really difficult to make a selection because they are so different, and all of them have different agendas and different objectives and are set up in different ways. So how to ensure that you have a fair representation of patient organizations? And is it possible to give a voice to all, or should we give a voice to only a few of them? But how do you select them then? How to deal with different inputs? Because we can expect that they will not have the same views, and how to weight these different views. What if they cannot engage because some of them won't have the resources? This was something that a few PIO representatives told us, that they would be interested, but they just don't have the resources. They just have to take care of their daily business, so to speak. Can we engage with PIOs affiliated with industry, or will there be a bias there, a problem? How to make sure that engagement is genuine, that the researchers also are interested in engaging, or whether they have, they could have some different interests that we might not know about. Can we require researchers to engage PIOs in their research? This is something that is developing now. We are experiencing this in Norway. The Research Council of Norway is now requiring on its new health programs that researchers have a plan in their research protocol for engaging stakeholders in their research. And the primary focus is on patient and patient groups. And this is a decision that comes from the top and that is creating a number of questions here in Norway, because people are wondering, how are we going to do this? They don't have the experience, they don't have the training, they don't know which recipe to follow, if there is any recipe. So this is raising a lot of questions here in Norway and also abroad. And how to perform this engagement, how to make it work. The literature is out there, but it's very varied, and it doesn't give you very precise direction to adopt. So there is some research to do there. And another critical point is how to evaluate the usefulness of engaging patient groups in research. How do we know that it works? And what is the impact? So this is something that we are trying to follow up now in a new EU-funded project that started in January this year. It's called LifeBrain. It is a project funded with 10 million euros. It gathers 14 partners from 8 countries. So the Norwegian Institute of Public Health is a partner in this project. LifeBrain is integrating data from 11 European brain imaging studies. So these are already established cohorts that have a lot of data, including imaging data. And the project is trying to use this data to identify protective and risk factors related to brain health. And in this project, we have a dedicated work package focusing solely on stakeholder engagement. And we are now in the process of brainstorming in LifeBrain to find out how to engage our stakeholders. So our stakeholders are policymakers, participants in the cohorts, research groups, but also patient groups. We are particularly interested in working with patient organizations. And we are basically trying to find out how to do this now. So we'll be running a number of stakeholder workshops and stakeholder consultations to find ways to work together. And this is going to be a very interesting experience. We are already now discovering that there will be a number of issues related to whom should we work with, how do we do it, what's the best method, what works for them and works for us, where should the focus be, and so on and so on. So just to summarize this presentation, when we conducted our study among PIO representatives, we discovered that there was a high interest in PM, although the concept of PM was not very well established among the representatives. But I would like to mention that even though they did not necessarily use the concept of personalized medicine, they were well aware of the medical developments taking place in their disease area. So they would know about developments within genetic research, for instance, but they would not necessarily make the link to personalized medicine, or they wouldn't call it personalized medicine. Cancer groups were more aware of personalized medicine than other groups. Maybe also because some groups felt that the focus has been so much on cancer that personalized medicine was maybe not relevant for their disease area. Despite interest in personalized medicine, there were concerns regarding its realization, and the financial aspects of personalized medicine were a very central focus. Also, the fact that infrastructure is missing and that the stakeholders, patients, healthcare professionals may not be ready for personalized medicine. Equity of access was seen as a very critical aspect that has to be developed further. And unfortunately, the way we had set up our interviews did not enable us to go to discuss this issue of equitable access more in depth, but it would have been interesting to do it. And it was clear that the PIO representatives were quite aware of the challenges. They believe that patient values have to be central, remain central in the whole personalized medicine approach. And they were very interested in contributing to the realization of PM. It is obviously, PIOs are obviously an underused resource, but they need a helping hand because they don't really know how to do this. So, yeah, that's about it. The paper is published and available online, and please contact me if you have any questions, or just ask me now. I'll be happy to answer you. Thank you.
Thank you so much, Isabelle. I think we're all clapping, but as you realise, not everyone's got their mic on. That's a fascinating study, and I've got, so maybe I'll start off the questions and then other people can come in. I think if you want to speak, just take your mic off and Imogen can help you do that if need be. So I thought it was really interesting that people wanted to help but didn't really find that there was an easy pathway for them to do that. But also that they said that they felt that the privacy constraints were too restrictive, because you know, we always have, we kind of have these statements or opinions that the privacy restrictions are too great to actually facilitate personalized medicine. But I was wondering if you could just give us a few insights to that, exactly what they meant by that, whether they thought that how they might be changed, or if there was kind of any real insights into how that little knot might be untangled a little bit.
Yeah, sure. Well, I think that this statement was motivated by a concern that research is too slow.
Yeah.
They experienced that setting up research projects take a lot of time, and partly because the regulatory requirements are so heavy on projects. So they experienced that research that they were encouraging was not taking place because it could be stopped by an ethics committee, or it could be stopped by the data inspectorate or something like that. And they had this understanding that there are so many rules that already exist. So, and the patients want the research to happen. So for them, it was a bit like stopping a train that is on its way, but just, you know, and shouldn't be stopped. So I'm not sure if they meant that conducting research is a trade-off, so that you can, in a way, do it and maybe jeopardize privacy because the research is needed. It's more important to do the research than to protect the privacy. I didn't ask them that, so I don't know whether it was what they meant, but I suspect that they, or my understanding, especially when I talked to a couple of them who were very interested in biobank research, they both said that, oh, there are so many rules already and we know that it's safe, so why not do the research?
Right, yeah. I'm sure that's a topic that you could just do a whole study on by itself. But I mean, it's interesting that your respondents actually picked that up and talked about that. I'm just wondering if there's anyone else who've got questions. If you look at the top of your webpage, there is a raise hand, but please come in. It was that Harriet.
Yeah.
If you could just say your name and institution.
Yes, so hi, I'm Harriet from the University of Oxford. So I had two questions, one of which may be incredibly basic, but I was just interested in the role that these patient interest organisations hold within Norway or within the Nordics more generally. Or the reason I ask is because in the UK we have loads of different charities. They're doing quite varied things depending on the size of the charity, depending on the sort of patient group, depending on whether they're largely raising money or they're trying to do some research or they're largely lobbying government. And I was just interested how that compares to your experiences and whether they have a specific role they're already fulfilling.
I cannot say they had one specific role because they were very different. So they had many different roles. Some organizations were so small that they focused primarily on accompanying patients through their journey in the healthcare system. So typically providing their information about the disease, telling them where to go and so on. So these were the small organizations. The larger organizations, and some of them were very large, pan-European organizations. So they had a much broader spectrum of activities spanning from patient education to financing and participating in research projects, to having dialogue with health technology assessment authorities, and so on. So, the different PIOs we talked to were very different, so it's hard to say that they had this one profile.
But generally, the sort of charity sector is strongly supported and it's busy and there are lots of different organizations. I'm just trying to sort of think about if their role to contribute is to sort of provide a bit of mediation almost between the scientific community and the patients themselves, how whether patients are actively seeking their support already and therefore that will work quite naturally, or whether this will be an additional sort of activity, if you see what I mean.
I think they already see themselves as mediators.
Mm-hmm.
So I think that when they said they wanted to contribute, I think they saw a more important role for themselves.
Yeah.
Maybe contributing more to research, setting up research projects in partnership with researchers, finding funding in partnership with researchers. I think they don't want to have just a consulting role. but they want to be more involved in the research. But again, this would depend on their size and the types of resources that they had, because as one said, for us it would be impossible to do more than what we do today because we don't have the resources.
Yeah. Thank you.
Any other questions? I can't hear you, Imogen.
Sorry, if anybody does have a question, you can either use the hand up mode, or you can physically put your hand up, as I've now put you all on video.
Or you can just say something.
Oh, I'm afraid we've lost Sandra Lee.
Okay. So Isabelle, when you were talking about your future work in the Life Brain study, how will you use these findings to actually help push that along, do you think? I know that before everybody came, you said that you're really uncertain about how to do this, but I'm certain that you've started to scope that out. I don't want to put you on the spot, but it would just be interesting to see how you go from this research to thinking about how you would involve PIOs in this this new study. I mean, obviously, one thing you could do is focus on patient groups that are actually very active in this area, in terms of neuroscience or in terms of some of the diseases that are associated with the brain.
Yeah, so what we will be doing is the following. As of today, that could change, of course, but
we won't hold you to it.
Yeah. So in the project, we are planning to have our first stakeholder workshop in November, in conjunction with the Life Brain annual meeting. And at this workshop, we are inviting a very small group of representatives from patient organizations. So that would be typically organizations working within Alzheimer, dementia, mental disorders, and so on. And we'll also be inviting policymakers, some researchers, some cohort participants will be there. So this will be a very small, not necessarily representative, but a very small group. And what we want to do is sit down around the table with them and tell them or explain to them that, okay, we are thinking about doing a number of activities in the project with you. How do you see that you want to be involved? Is it something that is realistic? Should we do things differently? And in Life Brain, the main objective is to develop strategies for personalized prevention and health follow-up. So typically, the vision is to enable people, both young and senior citizens, to monitor their health, use some home kits or some tests that they can use to check a number of medical or critical measures to know that can provide some information regarding their brain health. And we want to see what is needed to make sure that people follow up prevention recommendations. And here I think that the patient groups have a critical role because they are used to talk to patients. They are used to provide them with information. So what I really want to know is how can they help us do this? In Life Brain, we'll have a number of research. Hopefully we should have some findings once we have started with the research. So how do we translate these findings into information that we know for sure that people will use? And here I see that the patient groups normally should have a very critical role, but I think we need to ask them how they want to do this, how they want to contribute, because we as researchers cannot decide for themselves, for them. So really the first step is just to tell them the story, explain them what we want to do in the project, and ask them how do they see that they can contribute. We have some ideas, but we want them to be confirmed, and then really get them to do the work in a way, if possible. But it's really, we are tiptoeing. It's really exploratory work. For projects like LifeBrain, this is the first time that they were doing this in such an explicit way. So yeah, so it will be interesting to see what we manage to achieve.
And I mean, it will be a learning experience for them as well as for you. And there might be different techniques that you use, or new ones that you develop, or you will definitely walk away and say, oh, maybe we shouldn't have done it that way, or yes, we should have definitely done it that way. So it's interesting that, you know, you were kind of looking for some kind of template or way of doing it that, you know, might really guide you, and that, you know, maybe you could use or take bits out or whatever. But it was very interesting to hear that you found that there wasn't a really good template for doing that, that you didn't find that there was ready guidance in this area.
No, and since the Norwegian Research Council has set up this new requirement of engaging stakeholders in research projects, I think this is mandatory as of January 2017 or something. So this is something that is really a hot topic here in Norway. So there has been a number of workshops, seminars focusing on stakeholder engagement. How can this be done? Speakers have been invited. Some projects which had some experience in stakeholder engagement have been invited. So of course I went to these workshops. And what I learned from this is that there is a variety of tools or activities out there that can be used, and it's a bit of try and fail or try and success method that people use.
Yeah.
So the projects which had some experience could tell that, okay, we've been doing this and it worked more or less, so we don't really know, it was difficult to evaluate. What came out of it as a main message is that it's very interesting, but it definitely needs resources and time, something that often researchers do not have. So when planning for your research, you should also plan for the necessary time and resources to do this. So the interest is there, but the tools are so varied that it's hard to categorize them, and it's hard to know what works and what doesn't work. At least that's my experience, or what I got out of these meetings, and looking at the literature too, that it's really hard to say that this method will work and this method will not work, because it's so context dependent, and it's so dependent on who you have in front of you.
So I'm just going to ask you one more question, and then I'll ask if there's anyone else. It just seems as if, like, this is such a big change in policy for the Norwegian Biotechnology Board, and I'm just wondering, was there a consultation process which led up to that, or because how mandatory are the requirements? Are they enshrined in law, or are they just the requirements of the committee?
It's a requirement from the Ministry of Research. So I don't think it's written in law. There has been a national strategy, what would it be in Health 21. It's a national strategy that the government has been working on. And in this strategy, there is a requirement to engage, it is called user involvement in this strategy. So it's not written in the law per se, but it is becoming a requirement from decision makers and from funders. So basically you have to do it.
Oh, wow. 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 So but it was part of a consultation process.
There has been some consultation, but I couldn't tell you whether the researchers have been involved in this consultation. I think it has been rather at a top level that the consultations took place, and not necessarily among researchers, because my impression is that it comes as a surprise to many. That this is our
Okay. Great. Are there any other questions?
Nothing on the hands up.
Okay. Does anyone want to ask any other questions of Isabelle, or maybe suggest things that they've used which have been useful for them in terms of engaging patients?
Well, I would like to know.
No, nobody's got any advice for Isabelle. So if there's no more questions, then I suggest that maybe we close. Or does anyone have any questions? I've just seen Susan come online. Did you have a question, Susan?
Can you hear me?
Yes.
Just
very
quickly,
well.
You talked about it being a surprise to researchers. Was it also a surprise to the patients? Forgive me, I've come into you late, so if you already talked about this, I do apologize. But
no, we haven't. We haven't.
What was it a surprise at all levels except at the upper echelon level?
So something that was discussed at the workshops I attended is several patient groups were represented at these workshops, and what they told us is that they very often receive phone calls from researchers, preferably on a Friday evening, because, you know, deadline for applications is on Monday morning. And so they receive phone calls from desperate researchers saying, oh, we need to have a patient representative by Monday morning to put in our application. And what they're saying is that we are very happy to contribute, but we do not have unlimited resources. So we have some people who can be lay representative or patient representative, but they need to be trained. They need to understand what they're going to. So you need to explain what your project is. You need to explain to them what their role will be in the project, what you are expecting from them, how much time is this going to require, and so on and so on. So they were trying to say in a polite way that we are happy to contribute, but please prepare us and let us plan this together. So it was a bit of a surprise to them as well, so to say.
Yeah, I've heard other patients groups say that they have been on grants and things like that, and that they're not really treated with respect by researchers, that they're kind of, and this isn't all researchers, but there are cases where patients are just seen as, oh, let's just tick the box and have a patient representative, and as you say, not train them, not really engage them. And so I think it's not, well, it's an easy thing to treat people with respect, but I think it's not, because we haven't really kind of thought out exactly the best ways to do this, and it's still an evolving field. I think it is quite easy for it not to be given the priority it deserves, and also therefore, you know, people are sort of seen as a representative rather than actually having a more meaningful role in a project or research.
And I'm currently working with some colleagues at the Institute developing internal guidelines for stakeholder engagement, because this is something that our Institute also will have to relate to. So we've been looking a little bit at the literature and what's out there. And one important point is that you don't only need to train the patients and the patient groups, you also need to train the researchers, because this is not their profession. So I do understand that for them it might be difficult to do, or they don't really see the point. So we cannot just put a requirement on them without giving them the tools to do something in a proper way. So training the researchers is also an important aspect, I think.
Very true. Okay, so unless there's, this is your one last chance to ask questions. And if there aren't any more questions, then I think what we should do is just, well, I will thank Isabelle for a really interesting talk, and just it's so interesting to hear what's happening in Norway, because we often say that the Nordic countries are really well advanced in terms of what they're doing in terms of research, and so it's really interesting to hear that there's been these changes in policy and the effect that it's happening. So thank you very much for sharing that with us, and thank you for a fabulous presentation.
Well, thank you.
Okay.
Thank
It
you.
is my pleasure.
Thank you.
Bye.
Bye-bye. Have a nice summer to you all.
Yes,
Thank
and
you,
you,
you too.
Isabelle. Thank you.